As South Africa resumes the vaccination rollout, there is some uncertainty on how the vaccination program will work for people who are covered by medical aid schemes. The principal officer at the Government Employee Medical Aid Scheme, that's Dr. Stanley Moloabi, joins me to unpack this. Firstly, thanks for joining us this afternoon. This exercise really is to get a better understanding of how medical aid schemes, or what their role is going to be in as far as the vaccination drive is concerned. Firstly, let's unpack how the vaccination program will work.
Good afternoon, Stanley, and good afternoon to the viewers. In terms of how the medical aids will be involved in the vaccination program, in the main, medical aids are funders of healthcare needs. They cover the healthcare needs of those who contribute monthly.
Yeah.
So the main, in the main, medical aids will pay for the vaccine in accordance with the prescriptions of the Medical Schemes Act. And I think that's important because the COVID-19 was declared a prescribed minimum benefit, which means that that medical aids will be required to pay for the vaccine. That's in general. However, various medical aids have got various roles, and at the Government Employees Medical Scheme, because we cover the employees of government, we are involved, in the planning of how government employees will be covered and how the vaccine rollout will work. We are assisting government in the planning, and we will be involved in the vaccination program.
All right. So for those who do have medical aid, there's also the issue around co-payments, and some may have run out of their savings. So how exactly, and specifically speaking about GEMS, how exactly will you be covering those who may not have these savings in their account?
Yes. So as I just mentioned, that the COVID-19 SA disease is a prescribed minimum benefit entitlement. So what that means is that medical aids cannot say you've run out of benefits.
Right.
They are required to cover the cost of a vaccination, in this case, in full. So there are no co-payments that will apply for the cost of vaccination to all members of medical aids. And as you said, at GEMS, we have previously indicated that we are ready and we will cover the cost of vaccination in full.
So you say you are ready. Let's now speak about the process to register to get vaccinated. Now, how does that work?
So we all know that the vaccination program, it's a government-led program. The National Department of Health, it's basically the lead department. So the EVDS, which is basically the Electronic Vaccine Data System, has been established, and everybody who is due for a vaccine, in terms of the three-phase program that was announced by the minister, I think it's a few months now, is supposed to register on the EVDS, and then the EVDS will generate an SMS, which basically confirms your registration. And then when the time comes for you, when you have been allocated in the queue, you will receive another SMS informing you when and where you are expected to go and have your vaccination.
But who decides on who gets priority? Or there's still a lot of uncertainty, especially with the public in general, as to who registers first to get vaccinated or get their jab.
Yeah. So if you remember, the first announcement was that it's going to be in 3 phases.
Yes.
And the first phase was to have all healthcare workers, both in private and both in the public sector, be registered. So that is the first priority, because those are the frontline workers who are taking care of those, and they are very exposed, to the COVID pandemic. So that's the first prioritization. Now we are having the phase 2, which is earmarked to start on the 17th of May. And the prioritization basically has been based on the risk categories. And the one that was announced, I think it was Thursday last week, is those over the age of 60 years, mainly with comorbidities, and that is the so-called phase 2, I think 2A.
Yeah.
Yes, so the prioritization is basically all the people who are working behind the scenes based on scientific data, determining who is at risk, and then that determines where you will be in terms of those 3 phases.
All right. Let's also try to clear up some perceptions that people may have, especially when it comes to this vaccination program and how it's going to be rolled out. Is there an impression that's being set that those with medical aid schemes or who are covered by a medical aid scheme are going to get first preference, opposed to those who don't have any cover?
I think the government has made it very clear, and the minister has answered this question. The Minister of Health has answered this question several times. There is not going to be prioritization of those who are in medical aids. However, the prioritization is as per the phases. Those who are most at risk, which we have the frontline workers. So naturally, most of the people who are employed in the healthcare, most of them are actually covered by medical schemes. So they will be at the front of the queue. Then in the second phase that was announced, it is the prioritization is based on age and comorbidities, right? So both those who have medical aids and those who don't, who qualify in terms of these categories, will be then put on the queue. So at the moment, there hasn't been any pronouncement by government that those who have medical aids will be prioritized.
So one can imagine that you've probably been inundated with calls from your members seeking clarity as to how will the process work and when can they go register to get vaccinated. What are some of the most prevalent questions that you are getting at this time?
Actually, it's exactly that what you have said in terms of when is our chance going to come, is James going to pay for the vaccine, how are we going to know? So this information that I'm sharing, it's in line with all the plans that are in place. So Government Employees Medical Scheme, in essence, covers government employees. They happen to have been in the front line of the fight against COVID. That is why you find that the healthcare workers will be the first ones, and then you have those that are in other departments that are also, at the front line of service delivery. They were in the second priority. So the registration is on the EVDS, and it will be the one that will schedule when a person who qualifies will go for a vaccine. And we have that information in our messaging to our members via the various media platforms that we use to communicate with our members.
And would you say that your members are satisfied with the kind of responses that they're getting from you?
Well, they appreciate the information when they get it. We have also done a survey, in terms of what our members' knowledge is in terms of the vaccination program. And the information revealed there are issues of hesitancy. Vaccine hesitancy is really based on things like this very perceptions, whether it's safe or not. And we have that information out of the survey we've just conducted. The Council for Medical Scheme, who is the regulator of medical scheme, also did a survey recently. The information that came out of those two surveys is very valuable in terms of what are the messages we send to our members.
So the COVID-19 pandemic has prompted many people, especially those who are covered by the medical aid schemes, to revise or review the kind of cover that is provided to them. Are you also getting similar interactions with people asking you exactly what am I covered for? Should I be diagnosed with the COVID-19 virus and I'm hospitalized? What kind of cover will I be getting?
We're not getting those questions, and I'll tell you what the reason for that is. Right. At the beginning, we announced very early in the pandemic that the costs of COVID-19 will be covered in full by the medical schemes. And we have done that throughout. I mean, we are over a year now into the pandemic. We have paid over 4.2 billion for COVID-related costs as GEMS. And so those questions are not really coming our way because we had informed our members very widely that we'll be covering COVID-19 related costs in full. And now that we are in the vaccination phase and the COVID is still with us, we're still having quite a number of our members who are admitted to hospitals, and we cover the cost in full. Would
you say you're overwhelmed by the number of people who are seeking cover for their treatment for COVID-19? Are the numbers high?
The numbers are quite high. We fortunately are in a very good financial position to cover the costs. And the other thing that has happened is that during the pandemic, the other health care, the utilization of other health care costs went down, and that almost like balanced off the unplanned for COVID-19 related costs.
Dr. Stanley, you've given us quite a lot of information here, but for those who still have questions to ask, I mean, members of GEMS probably, who have a number of underlying questions that they need to ask, especially when it comes to the kind of cover that's offered to them, how do they get in touch with you?
So with GEMS is basically the various media platforms and mainly the website. And then when we are on the website, we've got telephone numbers and emails that where our members usually form our direct inquiries. So we will answer from there. But we also continue to ensure that we take out information related to what we are doing in relation to vaccination. And there'll be a lot of information actually even going forward, informing our members about how to get the correct information relating to vaccination, including the issues related to hesitancy to take the vaccine, because the vaccine is very important for us as a nation to actually win the war against the pandemic.
And in that same breath, how do we reassure people that the vaccines that are being rolled out are safe to be taken by your patients?
Yeah, that one is a very difficult one, and I'll tell you why. It's because of what, as we are all aware, that there are able people who are qualified in terms of, from the medical science point of view, who are advising government on this. And these decisions about safety are taken on the basis of evidence-based, the evidence that comes out of the various studies. And we've just had an experience of the Johnson & Johnson halting. The government has made sure that it takes into consideration whatever credible information that comes out of the studies to make decisions. So the safety issue is based on the evidence that is available on the ongoing scientific research. Remember that the vaccine was produced over a very short period when compared to other vaccines that were previously in use. And as a result, as information comes through, then decisions on safety are taken. And the experience on the Johnson & Johnson one, it's a recent experience. The government had to take a decision based on the available information, and they continue to do so. I mean, we know that there is an announcement that is imminent on the issue of the Johnson & Johnson, based on what the science people are advising on the rollout.
And as we wrap up, I mean, it is important to still factor in the fact that we are still in the midst of a pandemic. What's your parting shot or your words to citizens at large?
Let's continue to observe the hygienic, the non-medical measures that have always been, that was announced by the president from the beginning. Let us social distance, let us wear masks all the time, let us not go to gatherings unnecessarily. Let us always be aware that the pandemic is still here with us. The numbers have come down very well, but we are not sure whether there's going to be a third wave. So we need to continue to be very careful and then wait, for the rollout to come through.
Dr. Moloabi, thank you very much for your time.
Thank you.
That was the Principal Officer of GEMS, that's Dr. Stanley Moloabi. After this, we get more news and updates still to come. Stay with us.